Hey, it's Scott. And we're back at EMS World Expo in Las Vegas. And again, we're joined by Bob Page. And in a previous Give Me Five, we touched on the use of capnography, specifically beyond just verifying where your endotracheal tube is. And in that one, we predominantly focused on DKA, otherwise known as sugar of a million, and a pH that's way too gosh darn low. So now in this one, Bob, we're going to go ahead and just look at beyond just DKA.
I want to talk a second about sepsis. Sepsis is gotten a lot more press here recently. It's been grossly underdiagnosed over the years, but recent advances and recent attention to that has made this a more important item now. And no matter what your age is, you can get sepsis. Sepsis is a metabolic condition also where you're invaded by a bacteria or a virus or something that makes your body go haywire. When that happens, your body starts to fight the infection. You'll get the fever. You might have heard of the Sears criteria, or some people call it heat now, where if you have an elevated temperature or a lower temperature, plus you have tachypnea or tachycardia, and then of course the white cell count, which we don't usually get unless you're in a hospital. If you have 2 out of those 4, then you are considered sick. You meet the Sears criteria. Sepsis defined is Sears plus an infectious process. And so, for example, you come across someone who's complaining that they've been sick for the last week. You show up, they look like they're really sick. You touch their skin, it's hot. They say they got a fever. You grab their pulses, you find that they're tachypnic. They're tachycardic and they're tachypnic because you can see them breathing really fast. And then what's going on? Well, I've been blowing out this yellow-green snot out of my nose. What capnography does, in the past time, they've actually talked about doing serum lactate in the field, where they drawn serum lactate levels, and if the serum lactate's above 4, then that would consider to be serious, because as sepsis progresses, what you end up getting is an organ dysfunction, and that organ dysfunction releases serum lactate, or releases lactate in the bloodstream. And that can be detected. So usually hospitals won't pull the trigger on antibiotics until they have Sears infectious process and a metabolic condition caused by the organ dysfunction. So capnography has been proven in studies to correlate with a CO2 reading of less than 25 correlates with a serum lactate of above 4, which is considered severe sepsis. So many systems, but especially I know some ones in Florida specifically, that have actually adopted that, where they're using capnography as a tool to triage severity of sepsis. And so if you're in the field and you're not sure whether to call a sepsis alert or not, that's one thing you can do. You have the Sears criteria, an infectious process, and an end-tidal CO2 less than 25, that's severe sepsis. And that is worth a sepsis call to the hospital to activate the sepsis team.
And it really is important because in the ER and in some places in transport, you could do point of care testing like iStat, et cetera. And you can get a lactate back in like 10, 15 minutes, whatever it might be, depending on your toy. Versus capnography, you can literally just put it on and instantly say, okay, this is wacky, you look sick.
Right.
All right, you're potentially septic.
Yeah.
And like you described with the sepsis alert, it's kind of like a cardiac alert with the STEMI alert or
The
a stroke alert, whatever you
yeah.
want. Now they're doing sepsis alerts.
Right.
And then the idea being that some places now are even trying pre-hospital antibiotics.
Yeah.
Depending on where you're at. In the military, especially if you're out in the field for a long time, they're giving antibiotics as well. And in this case, again, it just makes sense. It's instantaneous. You look icky. You have X, Y, and Z plus one more confirming, factor here.
Right.
Saying, you know what, you're probably septic. And if you're not septic, you're thinking about becoming septic. And we're going to treat you as if you're septic until we prove you're not septic.
Yeah, sepsis has a high mortality. So this is where we had to really get serious about it. Serious as a heart attack, serious as sepsis. Yeah.
But in this case, it's kind of interesting because it sounds like really when you're dealing with sepsis, that in addition to all the fancy criteria and just looking at them and saying, yeah, you know what, you look sick. But taking it one step further, again, it's kind of neat to see how capnography can just, for lack of a better term, put that final nail in the coffin and say, you really are sick. And here's why I really think you're sick. And instantaneously, you can clue people in that you're sick.
Well, it's a clinical upgrade. It's a clinical upgrade. You go from, I guess it is, to this is it.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best: under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next PEDS patient could be your worst PEDS patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.